Safe Travels Podcast. Real women, conversations, real life. Safe Travels Podcast. Real women, real conversations, real life. Safe Travels Podcast.
Hello and welcome to Safe Travels Podcast. I am your host, Rashonda Nicole, the Bounce Back Queen.
Hello, I am Margaret, the life of the party.
And I am Cassie, aka the richest of the richest aunties.
Oh, okay then. And we have a special guest, Dr. Makesha Miggins, joining us today.
Hi, everyone.
Hello.
We are so happy to have you on. And today we're just going to talk about how to advocate for yourself. It's Breast Cancer Awareness Month, and we want to talk about our health. So today we are saying safe travels to what?
Not advocating for yourself in healthcare specifically.
Yes.
So first of all, Rashonda, tell us how you and Dr. Miggins are related.
Yes. So on my father's side, we are cousins. Now, I don't know what cousin, what number, but we're cousins. And she's also a great friend. And I call her my little sister. Our moms are really close friends, and she's just a sweetheart, and I'm just so proud of her, and I love her to death. But she is a big deal to me. She is a breast surgical oncologist at MD Anderson in Houston, Texas. So she's an expert in the field. So I felt like this would be a great opportunity for her to come on, and not only to educate us, but to also just join and vibe with us.
Yes, for sure. Well, we are definitely excited. We know you are super busy, so we thank you for your time. We thank you for the information that you're going to share with us. So let's kick this off. So, Rashonda, what are some questions that you think we need to discuss today, especially for our listeners, specifically Black women dealing with the healthcare system and breast cancer awareness?
Okay. I think one of the first questions, which we're talking about how to best advocate for yourself. So that would be the first question I would ask Dr. Miggins. How best should we advocate for ourselves? What should we be asking? What questions and what should we be doing?
So I think it's so important to advocate for yourself. You know, honestly, your physician should be your number one advocate. But oftentimes the relationship may not be such as that where they know exactly what you need. So I think it's important as a patient to just ask your physician, what healthcare screenings do I need to be having at what specific time? I think that's a very open-ended question, a very broad question, and it allows them to look at you not only as an individual, but as an individual at a specific age, at a specific point in life to determine what things you need. Because oftentimes we see patients who say, oh, well, I didn't know I needed to get, that colonoscopy or that mammogram, or I didn't know I needed a pap smear. Well, they shouldn't have to know that they need it, right? Their physician should be willing to make sure they get those things. But I think it's very important for a patient to just say, should I be getting any screenings right now, whether it's screenings for diabetes or for cancer? There are guidelines that are set in place, and you just want to make sure that people aren't forgetting to offer you the things that are appropriate for that point in your life.
Okay. What are some of the things you feel that you see when women come in? What are you seeing that did they miss those mammograms, or did the doctor not see something? What do you mostly see coming in?
Well, I think it's so variable. And there are different categories of women, right? There are the women who come in and they've been getting their mammograms yearly or however they were ordered. Of the note, we recommend yearly, but sometimes people don't get them every year. And they have a finding that was only seen on their mammogram or their ultrasound, right? So it's not that they felt something abnormal in their breast. That's a whole different type of person. That person got their screening test and they're coming in And usually they're just anxious and surprised that the screening exam showed what it did. Then there's the patient who comes in because they felt a lump, but they were either either embarrassed about it or in disbelief. And so they didn't tell their doctor, didn't tell anyone, and then they just kind of waited until that lump grew and grew so they couldn't ignore it anymore. And that's a different person than someone who was at their doctor getting their regular women's health screening exams, and the doctor felt a lump and sent them for imaging. So I think, we get a broad variety of patients, but they all usually fall into one of those three categories.
Okay.
Are there any symptoms, like besides the lump? Are there any symptoms that they usually have?
Yeah. So first, I would say that most patients we like to see should be asymptomatic at diagnosis. That means that it was just someone who was going in to get their screening imaging, and so it was diagnosed very early, usually if they are asymptomatic. But then, in addition to that, some of the warning signs, we all talk about the lumps and masses, and some people will say, well, I don't even examine my own breast because they're lumpy, bumpy at baseline, but you need to know your lumps and be able to determine what is different. But outside of that, the lump doesn't have to be in the breast. You can have enlarged lymph nodes. And the lymph nodes that we think about primarily with breast cancer and breast health are in the armpit, or what we call the axilla, so under your arm. You can have a change in breast size or shape. Sometimes you'll notice that the breast seems fuller or elevated compared to the other one. A change in the nipple. I like to tell people that as your kind of mama or whatever told you as a kid, don't pick up hitchhikers, your nipple shouldn't be hitchhiking either, right? It shouldn't be hanging out to the right or to the left. It really should be front and center. Now it could be hanging down, but that's a whole different problem of a life and aging and gravity. But it shouldn't really change direction. And if it was formerly out, it should no longer be in, or what we call inverted. And then there's this kind of scaliness. I like to say it looks like, probably we would say, oh, your nipple looks ashy, but it's the ash that doesn't go away with lotion. And it can look like someone has put a lace over the nipple. But really that is sometimes a sign of an early form of breast cancer. And then, of course, nipple discharge. If you're not lactating, then you really shouldn't be having nipple discharge. There are some physiologic normal discharges, but most people who are everyday people don't know the difference between a normal discharge and one that's abnormal. So if you have any nipple discharge, then you should be getting evaluated by a physician.
Okay. That's good information.
That is good information. I'm kind of scared because my nipples be ashy.
Put some lotion on.
There's a difference between ash and this kind of cancer reticular pattern.
I know, but
you know to put some lotion on.
So I tell patients, and you can have eczema of the nipple too, right?
Okay.
Eczema is a disease of skin. So, the thing is that if you're noticing something different with your nipple, then you need to get it evaluated.
Okay, because
she'll put some lotion on. I wanted to ask, is it anything that men should look for? Is it
that's
the same
a good question, yeah.
Should they look for the same?
Yeah, so I'm so glad that you brought that up, because a lot of people will see this podcast and think, oh, okay, it's about women, it doesn't pertain to me. And I think this is one of the reasons why we have to be very cautious when we think about October and breast cancer awareness. And, it's the color pink everywhere. Well, it could be the color blue for boy, too, right? So about 1% of men will have breast cancer. And their signs can be very similar. Usually they have a lump that is centered about the nipple, really behind the nipple. That's where the bulk of any breast tissue they may have will be. Obviously, we don't screen men because it's not very common for men to get breast cancer, but men should be paying attention to changes, the same kind of changes in the nipple, or a puckering or change in the skin that they may see, or if you feel a hard lump or not. Usually most of the time when we see men, and sometimes with women, it's usually because their significant other has noticed the change in them.
That's good to know. So I have a question. What is it? What does it really mean when you have dense breasts? So when you go get your exam done, the 4D, 3D, and you get that back saying it's normal, but your breasts are dense, and sometimes they ask for further testing. What does that actually mean?
Yeah, so not to sound smart, but it means exactly what it says. The tissue is dense or firmer. So when we think about the breast, it's really a lot of fat, and then there's the structures that are within the breast, the ducts, the lobules. So when a radiologist is looking at your mammogram, what they're looking at is tissue that looks black and tissue that looks white. Tissue that looks white is that denser component of the breast. The tissue that looks black is the fatty tissue in the breast. And so when people have a lot of white on their mammogram or white imaging, in the imaging, it's harder to detect the breast cancer in them. And so that's why you can get supplemental screening is what we call it, but that would be the addition of an ultrasound because you have dense breast. Or we get concerned that those people are at a slightly higher risk of cancer development, but likely sometimes they may present with cancer at a later stage just because we have been having more difficulty detecting the cancer in the breast. So for example, think about your breast when you're like 18 or 20 maybe. For most people, their breasts were really, really firm. And for lack of a better way of saying it, they weren't very pillowy or jiggly, right? And that's because the breasts were really dense. And so we don't recommend mammograms in really young people, like 18 to 20, even before age 40, really, because the breasts are very dense. And so if the breasts are very dense, it's harder to see because a lot of the things that are abnormal in the imaging are going to show up white as well. So really, I wish I could show you a picture of a mammogram to kind of show you what that dense white tissue looks like. But that's the reason why we get so concerned about it.
Okay. I'm glad you shared that information with me. Thank you.
Because you have dense breasts?
I do. And so they asked for additional testing. So I wanted to know before I called back to schedule that. So thank you.
Oh.
Yeah.
Well, I'm actually learning a lot because, I'm in that younger age group where I don't actually have to get mammograms yet. But for those younger girls though who are experiencing, maybe they found a lump, and they're scared, what would you say to them if they're noticing some changes and they're not necessarily the recommended age for the mammogram? What kind of encouragement would you give them to go ahead and get help?
So I think you touched on a couple of things that I want to highlight in that you said that you're not yet old enough for a mammogram. So that makes me want to talk about when does someone need to get a mammogram. So you should start mammogram screening if you're of normal average risk. Normal average risk means you don't have a gene abnormality that puts you at a higher risk of breast cancer, or you don't have a very strong family history that has raised your risk of breast cancer. You should start screening at age 40. But prior to age 40, people should be getting clinical breast exams. So that means that your doctor should be yearly examining your breast, at least by age 25. So if someone younger, let's say you're 30, and you develop a lump or bump in your breast, and it's something new to you, then I think that you should go tell your doctor immediately. And the reason why I say that is because most of the time it's absolutely nothing. It could be a cyst. It could be something we call fibroadenoma, which is a benign tumor or mass in the breast. But it also could be cancer. And I think what happens is a lot of times people will maybe tell a friend. So you're 25, 30, you say, I feel a lump in my breast. And they say, oh, girl, it's nothing. You're so young. It can't be cancer. It can't be this. It can't be that. But it can be. And so you don't really know what it is until you go get it evaluated. So in that person, I would say, yeah, you really should go see your doctor. Do you want me to go with you? If they're scared or nervous to do it, or if they don't know how to approach it with a doctor, I would say, just go to the doctor and say, I felt something in my breast. Your doctor should examine you. They may or may not feel what you feel, but if you feel something and they cannot replicate it, or they don't know, they should still be recommending imaging for you. And so if you're under the age of 40, That imaging can usually start with just an ultrasound of the breast. And then based on that ultrasound, you may need to go on to a mammogram, which is a little bit different than we do it if you're 40, then you need a mammogram usually to start with. But I think that so many times when I see my younger patients who come in, it is unfortunately someone has told them, girl, don't worry about that. You're too young or you're too this, when truthfully, you are not too young, right? Cancer affects the young and the old, not necessarily alike, but it does impact the young as well. So I would tell her, girlfriend, go get that mammogram or go get that doctor's appointment, go get that ultrasound, do whatever they tell you. And if the doctor says you don't need any imaging, I would say I don't feel comfortable with that.
Right.
And you can ask for imaging. It's harmless to say, I don't feel comfortable. And if you're talking to someone and they're not hearing what you're saying and they are, very dismissive of you, then that's really not the physician for you, or the healthcare provider for you. And you should seek care somewhere else and then tell them what your problem is. And someone will send you for the ultrasound.
Very good.
Yeah, because I've changed doctors, let me say this. I get my pap yearly and my doctor check my breast when I go in there, and I like that little check. He's a nice looking young man, so I appreciate that check. But no, I was having severe headaches, and I went to my doctor, was telling him about the headaches, and he was like, oh, it's probably stress, don't worry about it. And I'm like, no, you're not hearing me. I'm having migraines every single day. And he was like, I can just give you some migraine medicine. And I'm like, no, it's something bigger than that. So I actually left and went to a Black female doctor, explained my symptoms, and she ran every test on me. And even though it came back like nothing was wrong, but it really was stress. But I felt better because she took the time to listen to me and give me the test and really make sure it wasn't anything other than stress. And so, I'm big on advocating for myself. I will doctor hop until I feel comfortable with what they're telling me. And I'm always telling people, get a second opinion, because, that first one may not be the correct one, or it may be something different than what they told you.
Right.
And I just want to go back to what you were saying about younger women. When I was a freshman in college, I was only 19, and I found a lump in my breast during Christmas break. And I was cleaning the tub and felt it. And I told my mom. And so I ended up having a fibrocystic adenoma. And I had it removed during the Christmas break. So I was only 19 then. Mm-hmm. And that was very scary, because I'm thinking, oh my God, I have cancer,
Right.
But yeah.
Yeah. So you bring up a good point, right? That sometimes you can, at young ages, you still have to be aware, and you did the right thing. You told your mom got you to the doctor, and you had surgery. These days, though, sometimes we don't always operate on those things. A lot of times they don't require surgery. They can require what we call serial surveillance. So that just means like repeat ultrasounds, especially if something has been biopsied and proven to be benign. It doesn't always have to be removed. So I think I say that because sometimes people will find a lump, they get told that there's nothing to do, and then they go crazy about there's nothing to do. Like, why won't they operate on me? This is going to be cancer. It's going to turn into cancer. And then you have to be like, whoa, ma'am. I love to operate. It's what I do, but I don't want to operate on you for no reason. And so these days that we know that everything in the breast doesn't have to be removed, some things can be followed. And if they're stable, then you don't necessarily need surgery for them. So I think that also sometimes keeps people from going to get things evaluated, because they just see themselves going down this avenue of surgery, treatment, and all these things, when it's kind of like a snowball effect, when sometimes it might just really be repeat imaging for a couple of years, and then we say bye-bye, see you back when you're 40.
Mm-hmm.
Okay.
So is there anything that we can do to lower those risks of a breast cancer diagnosis, like our eating, our lifestyle, anything like that?
Yeah, so, I think just for cancer in general, we always tell patients that there are some things that have just been proven to be good to help reduce your risk of cancer, or if you have cancer, reduce your risk of a cancer recurrence. Now, again, this isn't going to make your risk 0%. There are certain things in your life that you cannot alter, like your genetics or some of your environmental exposures. But there are things that are really common. So like exercise. We recommend 150 minutes of exercise a week. Sounds like a lot when you say 150 minutes, but when you break it down, it's 30 minutes 5 times a week. Weightlifting or strength training twice a week. Limiting your alcohol intake, which is sometimes a big one for people. So the recommendation is no more than 1 drink per day. Understanding that drinking at any rate increases your risk of cancer development, not just breast cancer, but liver cancer and other cancers as well. But I think it's very important to say that 1 drink a day, you can't group it. So, you might say, well, I didn't drink Monday through Thursday, but okay, Friday I'm gonna have 5 because that's my Monday, Tuesday, Wednesday, Thursday drink and my Friday drink. But binge drinking is actually worse for you than having 1 drink per day. So not smoking is important. And then your diet, your plate, and I need to work on this myself. Your plate should probably be 2/3 plant-based, plant and fruit-based, and not 2/3 meat-based. We are not carnivores, although we tend to act like it. We are not carnivores. We're more omnivores, so we can eat meat and plant, and we should actually have more plants in our diet. And then, of course, when we think about processed foods, just in general, so try to limit your nitrates, things like that, just because processed foods and chemicals just aren't good for us anyway, even though they are abundant in our food and products that we use. They're not good for us, and we know that. But those are the kind of most common things that I think about. And especially when I think about breast cancer and those things, especially women who are menopausal, those things become even more important because, of course, we know that breast cancer is a factor of aging. It's kind of like how your grandmother might say, keep living. And it's one of those things. When I see a lot of patients, they say, I don't understand why I got this. And I was like, oh, okay, because you're a woman and you kept living. And that's really often what it is that you're a woman and you kept living. And the older we get, our risk of these cancers do increase.
Okay. And our breasts are just, it's what makes us women. Like they're just so a part of who we are as women. So when somebody receives that diagnosis and they're going to have their breasts removed, what kind of, I guess, follow up, what kind of therapy do they go through? Because, I can just see a woman grieving that loss, again, because it makes you a woman.
So a couple things just to tack on, not to kind of go against you, Cassie, but it doesn't make you a woman. Your breasts don't make you a woman. They are part of development process, but every woman doesn't find her identity in her breast or other structural features.
Yes, right? Come on.
There are some people who will find their identity other ways. And then the other thing is that every woman who gets breast cancer doesn't have to lose their breast.
That's right.
In fact, the majority of women who decide to have mastectomies or their breast removed are women who are freely choosing to do so. So I think it's a little bit of a misconception that breast cancer results in loss of the breast. It can result in changes in the breast. This is true. And for some women, it absolutely has to result in loss of the breast. But for the vast majority of my patients and others who get mastectomies, they are making a personal decision to do so. So I think kind of to then go a little bit step further about what do we do or what do we offer those women? I think the psychosocial support is so key and so big. First, I like to make sure that the person is making the decision based on their own desire. So, and I say that because there can be a lot of people in the room with you when you come to the doctor. It could be your mom, your best friend, maybe a sister, your husband, your significant other, whoever that might be. And everyone has a whole lot of opinions. And the truth is their opinions don't really matter because it's your body and your cancer and your decision. And so a lot of people want to give their input, but most of those people in the room don't have cancer. And the person with the loudest voice and the most sure person is often the person who doesn't have the diagnosis, who has all the advice. So the first thing I do is I try to ask my patients, what do you desire? Especially if they're a candidate who can have a lumpectomy or a mastectomy. So I'm asking them really, do you feel like this cancer was a roadblock or a speed bump and you have to slow down, go over the speed bump, but accelerate on the back end? Or do you feel like this cancer has been devastating to you, your breast has offended you, and you do not desire to have this breast on your body anymore? And will you not be able to sleep at night if you keep your breast? For some patients, the answer is I will not be able to sleep at night if I keep my breast. And that's how they end up getting a mastectomy. So sometimes people are treating their own anxiety with the surgical choice. But we offer a lot of support, and every place doesn't have this, but there are body image psychologists who help women become comfortable with their body again. And I say women, but also men, because most men who have breast cancer often end up getting a mastectomy. And so men will also have some type of, I hate to call it an identity crisis, but some type of insecurity about their body because it has changed. And so that's really the thing. It's the change in your body that is prompting an insecurity, and having the appropriate psychosocial support services, offering people breast reconstruction when appropriate, and also offering them breast prosthesis as an alternative to breast reconstruction if they weren't appropriate for reconstruction or if they did not desire it.
Okay.
Well, thank you for that. And so good on we don't find our identity in our breasts. That is so good, because I feel like a lot of us do. So just to hear you say that as a doctor, we definitely appreciate that. We have had an amazing conversation on breast cancer awareness, and we thank you so much for your time.
Thank you.
So October is Breast Cancer Awareness Month. So Rashonda, tell them the news.
This is our breast cancer awareness t-shirt for October, Safe Travels t-shirt. So if anybody wants to order one, they'll be on the website.
And what is the website?
RashondaNicole.com.
All right. Well, thank you, Dr. Miggins, so much for your time. We have learned. We will definitely be advocating better for ourselves with these doctors.
Thank you.
Thank you so much. It's been a pleasure to be here and to share in this conversation. If I would have any parting words, I would just tell people, always remember that you are the top priority when you're in the office with the doctor at that time. So all of their attention should be focused on you.
Safe travels.
Absolutely.
Thank you.
Thank you.
Thank you.
Safe travels.
Safe travels.
Safe travels podcast. Real women. Real conversations. Real life. Safe travels podcast.